Hey guys, today we are going to show you how to release the low back and really the whole fascial line from the knee to the mid back, specifically the QL, and this is a correction for anterior pelvic tilt. So if you've found that in your patients or yourself, this is a great way to correct it at home. This is great homework to give your clients so that they can continue your work in between sessions. So my favorite thing to use is just a really nice yoga belt, but if someone doesn't have this prop, then you can also use like a scarf, as long as it is not stretchy. You don't want a stretchy thing, so people can't use like resistance bands or anything. A towel or a scarf is pretty ideal, or even sometimes an actual belt can work if it's long enough and they can get a good grip on either side, because they're going to need a lot of the prop. So you're going to lay back and set up just like we would on the table. So I like to use a yoga mat. Again, that's not a prop that they actually need, although most people have one nowadays. So feet right beneath the hip bones, right beneath the ischium, and then you're going to get the shoulders underneath. And we might as well, since we're setting up, just kind of set up like we would for a real yoga pose. So shoulders onto the back, shoulder blades down towards the hips, and then pressing the triceps into the mat and elbows into the mat, and then pressing the hips nice and high as you can. Big breath in, exhaling, slowly setting down, and then extending, sliding the legs long. Now from here, you're going to have them or yourself, you're going to take your belt pretty much in like the middle area and then give yourself quite a bit of space here. You're going to bend whichever leg you're starting with. I'm going to start with my right leg and then jump rope that belt right around the mid thigh. So now you want the belt to be in that meat of the hamstring, so not too close to the knee, not too close to the groin, really pretty much in the middle there, right in the belly of the muscle. And then you've got a good grip, so I wrap my belt around my hands so that I can really get a solid grip. That's the only thing with a towel, is making sure it's not too thick or too short, because people do have to be able to get a solid grip. The other thing that can happen with this that you want people to be aware of is we are going to be using our arms and hands for this resistance and pressure, and so people can sometimes scrunch their shoulders up, and you want to make sure that doesn't happen. So just reminding people, keep your shoulders down away from your ears, and to get more pull, more movement here, you want your elbows to come wide rather than your shoulders to scrunch up. So that's just a key. Elbows wide as you move the leg closer. Now, just like when they're on the table, I could bring my leg all the way up here, but this is a different action. That's not what I'm looking to do. We're looking to release that QL, glute, hamstring, right? So, and also simultaneously it often releases psoas and iliacus. So you're going to, just like they would on the table, we're kind of looking for that feather edge. So you let the leg be kind of floppy in the belt, right? I could come all the way up here to like a 15-degree angle, but we're going to start out here at more of like whatever beyond a 90 is. So we're going to let the leg just flop into that belt. And so I'm holding with my arms, but my leg and hip is relaxed. So we're going to let it be there. And then just like when they're on the table, we do that C shape or that moon shape. So it's, you let the leg flop, and then using the hands and arms, you go down, out, and up. And this ensures that the femur is in the right placement in the hip socket. So this is really important because you're actually activating and stimulating different muscle groups if you don't get this where it needs to be. And their compensation patterns will still show up more if it isn't where it needs to be. So we really need this to relax, and we have to do that setup, that down, out, and up, okay? And then again, the thigh relaxes. I usually have people do that down, out, and up, that C shape, about 2 to 3 times, especially as they're starting getting used to this move, just to make sure it's in the right direction, the right placement. So then once you're there, nice deep inhale, into the belly, and as you exhale, you're going to press that thigh into the belt. So pressing, I'm gently resisting with my arms here. Big, big breath. And you're matching your own pressure here, so that part's actually nice. It also teaches your patients what it feels like to resist, and so next time they're on your table, they may not do that like really strong pressing that people like to do because they want to prove they're strong. They kind of understand. They begin to develop this body awareness, this self-awareness, which is what it's all about. So big deep breath in, and then we're going to exhale, and as we exhale, we relax that leg. So see how it comes just a little bit closer then. And then usually a big breath in and out here, just being soft with it. And then big breath in and exhale and press the thigh down into the belt again. So now I'm resisting. I'm pulling up with my hands and arms, and I'm pressing down with my thigh, right down into that belt. Big breath in. And again, just like on the table, I usually have people hold for one full breath in and out on their first rep, and then maybe 2, 3, even 5 breaths in the subsequent reps. It kind of depends on the pace that they're breathing. So I usually say 8 to 10 seconds on the first one and about 13 seconds on your subsequent presses. Big breath in, exhale, relax that way. Good. And you see how it gets a little more movement in between. Sometimes this in between breath when it's resting is also where you get a lot of movement, because it's that safety, offering a little more opening in the nervous system. So the muscles and joints often relax in this in between space even more. Good. So again, big deep breath in, and exhale, press that thigh down into the belt. Good. And then big belly breath in. And exhale, relax. And just like on the table, we always press on an exhale, and we always relax on an exhale. And we always have a breath in between. Sometimes in our shoulder work, we don't always have to have the in-between breath. Things can move a little quicker there. But in these bigger releases, it's pretty important, because you want that extra juice, that time for everything to go. And if somebody's really contracted in their neck and shoulders, I do like to have that in between time. Big breath in. Exhale, press the thigh down. And it is important for you to do these too, because I want you to feel what it feels like to get these releases. Now, releasing yourself is less potent in one session, if that makes sense, than having someone else do the work on you. But doing this work, you can do it every day, right? It takes a couple minutes, and you can do it on yourself all the time, or anytime you're in discomfort. And it helps you develop awareness of your own body, your own patterns. It helps your systems release. And it gives you awareness to guide your patients and to know what it feels like, right? So now, relaxing breath, and then I unwind my hands, and then I straighten that leg. So the leg's pretty relaxed for all that. And now, this is a great space to feel the difference between the two sides. Sometimes you won't feel it, but a lot of the time, one side will feel much longer, more open, more lengthened than the other side. I also typically have people do their high side or their greater tilt first and do more repetitions on that side. So usually you do 3 to 4 on your we'll call it your louder side, because I don't like to call it your wrong side, your off side, or your trouble side, but some people do call it that. But I will say on your side that has a more intense tilt or is higher elevation, that side usually needs an extra rep or 2. So 3 to 4 reps on that side. And then if people are just tight or they're really anterior pelvic tilt on both sides, then do equal reps. But yeah, most people I find need about 3 to 4 on one side and maybe 2 to 3 on the other. Sometimes even only 1 on the other, but usually about 2. It's usually kind of 3 to 4 and 2 is what I find. Again, if somebody's really just a pelvic tilt is their biggest problem, then 3 to 4 reps on both sides is great. And we're gonna jump rope that belt to the mid thigh on the other side now. So my leg I just did is straight. Now I'm moving on to the other side. And so again, meat of the hamstring, not too close to the knee, not too close to the groin, right in the belly of those hamstring grooves. So then I'm let my leg relax, right? I can go up here, but this is not what we're going for. We want to get here, but with like no resistance, no pain. So we start way out here beyond a 90, right? Maybe a 100-degree angle. So here we go. It's scoop down, out, and up. It's that C shape. Down, out, and up. Our little crescent moon. One more. And the leg is relaxed. It's really the arms allowing this to happen. And so now my leg is relaxed. I know my femur's in the right part of my hip socket for all this action to happen. So nice deep inhale. Exhale, press the thigh down into that belt. I'm resisting myself here. Big deep breath in. Exhale, relax the thigh. Pulls a little bit closer to the torso. Big deep breath in. Exhale, press the thigh down. And we're going to stay here for a few breaths, big breaths into the belly, and complete exhales. Honestly, a full nasal breath in and a full exhale out the mouth is really awesome here. That gets everything deeper faster. So it releases tension quicker, it gets a deeper stretch, and it helps the body release more. So that's just a good thing to know for yoga, for body work, for all of it, for meditation. Big deep breath through the nose, and then longer, fuller exhale out the mouth. That's like your deepest relaxation type breath. And big breath in, and relax. Good. Thigh comes a little closer to the torso. Big breath in. Exhaling, relaxing breath. And then big breath in. Exhale, press the thigh down into the belt. Good. Keep breathing, keep pressing. And big breath in. Exhale, relax it. Good. Relaxing breath in and out. Remembering this is often where we even get a little more release. And just for the sake of video, I'm going to do one more on this side. Maybe this is your more intense side, so you're going to want to do an extra one. Maybe you know that your right side was worse, so you're just going to let this relax now. Inhale, exhale, press down into the belt. Resist yourself. And again, remember you don't want your shoulders to scrunch. Elbows wide, shoulders low, away from the ears. Breath in and out here. See if there's a little micro movement comes a little closer, and then relaxing that leg down and just feeling into the hips, the pelvis, the low back, the back of the legs, and just feeling how long you feel, how tall, how open. Usually feels really good. And pretty balanced now that we've done both sides. And then I always make sure people bend their knees and come to their side to come up, right? People have this inclination to like push through. Even on the table, I try to say, okay, let's bend your knees,
roll to your side. I don't want you to undo all that good work we just did. So reminding yourself that, and your people, that when they're doing this work at home, make sure they come out of it gently so they're not undoing all the magic they just released. All right, so that was for a pelvic tilt, for an anterior pelvic tilt, or just QL release. Releasing from the knee all the way to the rib cage.